Hello, everybody, and thank you for joining today. It's my pleasure to welcome you to this PQI Innovation webinar titled Promoting Neonatal Equity and Justice Through the Neonatal Justice Collaborative. My name is Kayla Vitek, and I will be operating the Zoom logistics for this webinar and introducing today's speakers. While I'm not providing tech support for PQI, I am the project manager for the Massachusetts State Perinatal Quality Collaborative. A couple of housekeeping items. This webinar is being recorded and will be posted for free on the PQI website. There will be time for Q&A at the end of the presentation. Please type any questions you have into the chat and we will address them. If you experience any technical issues, please send me a private message via Zoom. So now to introduce our speakers. Dr. Uchenna Anani is an assistant professor of clinical pediatrics in the Division of Neonatology and the assistant director for the Pediatrics Residency program at Monroe Carell Jr. Children's Hospital at Vanderbilt. She completed medical school at Howard University College of Medicine, residency at the University of Michigan, and the fellowship at Vanderbilt with a certificate in biomedical ethics. In addition to her research in trauma-informed care and neonatal ethics, she is most passionate about health equity in medical education, mentorship, and workforce diversity, with the ultimate mission to promote spaces of belonging for all trainees and learners in the clinical environment. She currently serves as one of the junior leaders for the Neonatal Justice Collaborative Subcommittee on Medical Education and Workforce Diversity. Our second speaker is Dr. Kayla Karvonen, and she is a neonatal perinatal fellow at the University of California, San Francisco. She's also the chair of the Neonatal Justice Collaborative and is a health equity researcher. Her research explores how structural racism impacts preterm infants and their caregivers within and outside of the neonatal intensive care unit. And now I'll turn it over to Dr. Deborah Bingham, who is the founder and CEO of the Institute for Perinatal Quality Improvement. Thank you all for listening and enjoy this webinar.
So great to be with you all today. Thank you for joining. I am going to give a little bit of introduction, some updates on what's happening at the Institute for Perinatal Quality Improvement. And just a reminder that all decisions we make here at the Institute for Perinatal Quality Improvement are towards meeting our mission. And our mission is to expand the use of improvement science in order to eliminate preventable perinatal morbidity and mortality, and also to end perinatal racial and ethnic disparities. So we're so glad you joined us and excited to have the Neonatal Justice Collaborative, have you learn about the Neonatal Justice Collaborative. We know that we could do better in the United States when we could look at our infant mortality rates. Different states are doing better than other states. In addition, we know that within each state, there are different cities and sections of those states that are doing better than other sections. And there is no biologic or genetic explanation for that. It's really, as far as it's much more related to how people are being treated and not some inherent biologic or genetic condition due to race or ethnicity. We also know that pregnancy-related mortality ratios have increased over the last several years, unfortunately, despite all of our efforts to try to reduce these deaths. And we know the leading causes are affected by race, ethnicity. There are differences in those outcomes, and the number of pregnancy-related mortality ratios vary significantly. And again, there is no inherent biologic or genetic explanation for this. So that means we have opportunities to both reduce deaths and injuries, and also and to see, like we previously had fewer injuries than we do at the time. So the severe maternal morbidity has also risen. And that's why we were formed, in order to utilize and apply quality improvement methods to address these inequities in outcomes. So a little update from us. First, just want to let you know, as a QI leader in the country, I know that I have learned that conversation is where change begins. And we all have the power to change the conversation. And that's any conversation we are a part of. Silence, talking, facial expressions, body position all affect that conversation, right? So in particular, what we say or don't say. And so we're changing the conversation by bringing you a webinar today, and hopefully you will share this information out with your networks. We also have created what's called the Speak Up program. It's Speak Up Against Racism, and it includes the acronym Speak Up. And this is to remind us of ways in which we can each individually act in order to eliminate racial and ethnic disparities in our facilities, in our communities, and in fact, eliminate all inequities. So our action and learning pathway includes the champion level, and I see some champions on the call today, so welcome. And then others who become champion choose to become ambassadors of the program. And then those that are champion and ambassadors are eligible to apply to become faculty. And we now have 4 new faculty for this important program. And we have nearly 2,000 Speak Up champions in the United States as well. So we're very excited about the growth of this program and hope that you join us. We have 2 national courses coming out this fall. I mean, in 2024, not this fall. Well, the fall's over. So we're in winter now. Anyway, we're going to be in person in Galveston, Texas on February 16th, and would love to have people join us there. And then we also have a national virtual course on June 14th. And so love to have you join us on the 14th or 20th and 21st of June if you want to join the national course virtually. Or in person, we'd love to have you come to Galveston. Subsequently, we also have a Speak Up Ambassador course on May 17th. So we're excited to host another ambassador course for the country. We have 3 modules that are why everyone must speak up, pledging to speak up, and how to speak up. And so those modules are available on the website, great. I love how many people have already accessed these. They're making a huge difference for people. They are adjuncts to the live virtual courses. Every February, this is now our 3rd time, we host a 28-day anti-racism challenge. And we're repeating version 2 because it's so filled with so much content. And so even if you did version 2 last year, please join us to repeat and deepen your understanding each day. There is a reflection, a learning activity, and then an action that you can do that day. And you will be getting though if you register, then you get emails every day with all the links, making it super easy. And we keep actions very short so that you can accomplish them in a day. And that starts on February 1st. Registration is now open and live, and so we'd love to have you join us. And Kayla, if you get a chance, it would be great to have you post the link to the 28-day challenge. We also have in our intermittent auscultation, we're working to promote freedom of movement in labor in order to help reduce overuse, to eliminate overuse of cesarean births in the United States. And we're very thrilled that this course is offered by us, as well as being offered by the Association of Women's Health Obstetric and Neonatal Nurses. We also put out great stories, solutions, just like today's webinar, where share what people are doing across the country. And Connie Clausen's profile is very relevant to today's discussions. So if you haven't read about the work they're doing at their hospital level neonatal unit, you would probably be very interested in learning what Connie and others have been doing. For our intermittent auscultation simulation education, this is how many people have as of June of 2022. So it's this map's a little old, but it gives you a sense of how broad our reach is for that course. For our quality perinatal quality improvement innovations webinar series, which you are joining us today for one of many. Our next one will be on January 30th, 2024. And it's going to be a discussion of the paper that Dr. Audra Meadows was the lead author on, which is entitled A Narrative Review of the Role of Perinatal Quality Collaboratives in Promoting Racial Equity. So, and that registration is live, and again, it's free to join these webinars. We would love to have support for all the work we do, and our professional members help support us and also get discounts on any of the events that are paid events. So please consider joining us. We do have a free basic member level, and to keep you'll be kept up to date. So those of you who registered for the webinar today, then you're automatically in our database, and we'll keep you up to date as well. So without further ado, just let us know. Keep in mind, QI saves lives. Let us know if you have suggestions or comments or any other questions. You can email us at info@perinatalqi.org. And thank you again for being here today. And I'm very excited to turn the time over to our esteemed speakers. So yeah, Uchi and Kayla, I'll let you take things on now.
Great. Thank you so much, Dr. Bingham, for this space and the opportunity to be able to talk with you all today about the Neonatal Justice Collaborative. We're really grateful. I want to share with you a little bit about the Neonatal Justice Collaborative and how we came to be. We are a new grassroots collaborative that is national, and we're focused on promoting equity and justice through collaboration. We are about 1.5 years in now, and we'd love to share with you a little bit about us. First, though, next slide, I will go through a land acknowledgement. So I'm coming from UCSF. We would like to acknowledge the Ramaytush Ohlone people, who are the traditional custodians of this land. We pay our respects to the Ramaytush Ohlone elders, past, present, and future, who call this place, the land that UCSF sits upon, their home. We are proud to continue their tradition of coming together and growing as a community. We thank the Ramaytush Ohlone community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding. Next slide. So today I'll be describing the mission and the vision of our collaborative. We will be describing the current state of our efforts and how neonatal health equity work is occurring currently, and then our efforts to really de-silo the health equity initiatives that are out there. And then I'm hoping that by the end of this presentation that you'll be able to learn about opportunities to engage with us. Next slide. So my personal research interest has really focused on promoting the long-term health for Black families who have preterm infants. I've worked a lot within my own NICU to understand how racism impacts families, and worked on local initiatives on how to improve the racial inequities that we see in our unit. And as I became familiar with the field of neonatal health equity more broadly, as a pediatrics resident and as a neonatology fellow, I really became acutely aware of the natural silos that exist in our work. In medicine, we tend to work in silos. I think that's very natural occurrence, that you tend to work with people who are in your same institution, therefore within your same geography, in your same city, in the same state, on the same coast. We tend to work within our own types of hospitals, so within community hospitals or academic hospitals with limited partnership. We tend to stick within our field of interest. So research folks tend to talk to research folks, and quality improvement folks tend to talk to other quality improvement enthusiasts. And we tend to also work with individuals who share our same role. So parents talking to other parent advocates, and nurses to nurses, et cetera. And that's unfortunately a natural, the natural way that work tends to get done. Next slide. And I think there's some consequences of that. We tend to have inefficiency or duplication if we're working on similar projects across the country, tackling similar problems, yet not sharing that work with one another. There can be certainly a loss of information as we work on these initiatives separately, missed opportunities. And on a personal level, the neonatal health equity work is hard. It can certainly result in personal isolation or burnout and fatigue. And so I really saw an opportunity to share our resources and information, share our successes, share our challenges while doing this work, and really to help the work become more productive and efficient. We want this work is so important to our families, and we want it to be the best work that we can do. And so when we work together, we certainly can have more innovation, and then on a personal level, more satisfaction, more opportunity. Next slide. So that's how the Neonatal Justice Collaborative was really born, was thinking about these silos and how we could bridge across these silos. And so we, again, launched in 2022. We created this mission and vision statement, which I'll read to you all. So our mission statement is to advance health equity, anti-racism, and social justice in the field of neonatology by addressing disparities in neonatal care and health outcomes using collaborative and action-oriented research, advocacy, and medical education to support and empower families and infants. We envision a future for neonatology where all infants share equal promise of future health and longevity, and where the clinical and academic workforce are collectively and actively engaged in promoting social justice and anti-racism. Next slide. So again, this started with an idea. So I reached out to junior faculty across the country who I saw were working on neonatal health equity work, and asked them if they thought that there was a space for a collaborative like this. And I was met with a lot of enthusiasm from our steering committee group, and Dr. Anani was a part of that steering committee from the very beginning. We imagined what a collaborative like this might look like. We defined our mission and vision together over the course of 6 to 8 months, meeting regularly. And we launched our collaborative in that April 2022. And as you can see, we've grown tremendously. We had 208 members in January 2023 and 250 in August. And so our interests and our membership has really grown over time, which we're really excited about. And, we started as, again, kind of operating in a silo and knowing a lot of physicians who are interested in this work. And so we have a lot of physicians who are members, and we've really made a deliberate effort to diversify our membership and really reach out to other disciplines that we know we can't do this work with any one silo. And so that's been a really big focus this year, is really these outreach efforts to all interested parties. So next slide. I feel really grateful to have a lot of leaders across the country who are leaders in neonatal health equity in a number of spaces. We have our core leadership where I'm the chair and founder of the Neonatal Justice Collaborative, and Yarden Freeman is the vice chair. I know Liz Rogers is on the call. She's a senior faculty advisor to us on the executive committee. And I'm sure you're familiar with many of the faces on this slide. we organized ourselves into 4 different subcommittees. So our policy and advocacy subcommittee, a medical education and workforce diversity subcommittee where Dr. Anani is a faculty lead, quality improvement subcommittee, and then the research subcommittee. And each subcommittee has its own goals and objectives for the year, but we very much work together, and any member can join any event, and events are certainly held with multiple subcommittees together. And so we have many different initiatives and events going on, which I'll get into in a little bit, but just also want to highlight our logistic leadership who have put together our networking events and organize ourselves and our schedule and our social media accounts. Next slide.
Okay, so I'll go ahead and talk a little bit about some of the work that we're doing within each of our subcommittees, and also talk about some upcoming plans that we have to kind of promote interdisciplinary workforce diversity, particularly within the medical education subcommittee. Next slide. So from within our research subcommittee, and just to kind of give a background for all of our subcommittees, we really came with the mindset of how can we address this using a very systematic or structured way, almost as if we were kind of addressing from a QI framework. And so we really were very thoughtful about creating global aims within each subcommittee, as well as kind of specific aims. And so some of the aims within the research committee, we're focusing on how you can really promote career development and training. And so action items included creation of a funding and training opportunities repository within neonatal health equity, promotion of mentor-mentee connections, and then also throwing out ideas and for workshops. So basics of health equity research methods, how to measure effectiveness of health equity efforts, and then also understanding and measuring structural and institutional racism. The picture here demonstrated also talks about our most recent PAS workshop that we did that really centered on how we can come together in small groups to really address how we can break down or de-silo neonatal health equity within our prospective spaces. And that also includes research. And so hopefully we'll be able to write up that work very soon. Next slide. And so one of the activities within the subcommittee for research is our works in progress. And so the works in progress really centers on feedback from a diverse group of neonatal health equity enthusiasts, advancing health equity, race, anti-racism, and social justice within neonatology, and the research work that we do, gaining experience conducting research skillfully, presenting to a national audience of researchers, and then also providing useful feedback to peers regarding one's research. And so our next work in progress is scheduled for December 6th, 2:30 to 3:30 p.m. Eastern Standard Time. We'll be featuring Dr. Meg Barcroft, who's a NICU and QI fellow. And her work will be entitled Validating Infant Demographics Within a Regional NICU Network and Equity-Focused QI Initiative. And so feel free, we've also included the links that will be shared during this presentation, but feel free to also use this QR code to sign up for the future works in progress. Next slide. So within our policy and advocacy subcommittee, we have been focusing on initiatives to really promote collaboration and really collaboration on documents, on op-ed topics and mentorship around that. And so one of the great workshops and sessions that this committee has done has been centered on how to really, what are the skill sets that you need to write an op-ed, a successful op-ed. And so that has been really well received within our membership. Additionally, many of our policy leaders were instrumental in organizing a writing team or groups of writing teams for Neo Reviews, which is a case series section within the journal Pediatrics that's focused specifically on equity, diversity, inclusion. Next. And so some of the work that we've already seen within this Neo Reviews case series includes articles talking about defining gender and infant care, equity in policies regarding urine drug testing in infants, for example, and then most recently, the impact and trauma of Child Protective Services referrals on families in the NICU. Next slide. Within our quality improvement subcommittee, this is actually our most recent formed committee. The global aim here is really integrating equity-focused quality improvement practices into the national perinatal QI landscape. And so a lot of their key drivers that they've identified within this group include how we can have more family representation when it comes to quality improvement efforts, data accuracy, so how are we accurately collecting data on race and ethnicity, education around this framework, and then also dissemination of this work. And our members of our QI subcommittee had the privilege of presenting at the recent Children's Hospital National Consortium this past October, where they really talked about the work that they're doing, specifically the equity-focused QI framework and how to drive change that leads equitable improvement within clinical practice. Next slide. And so I also want to mention within the subcommittee, they'll actually be having one of their next upcoming meetings this Friday, December 1st, 3 to 4 p.m. Eastern Time. And so please feel free to join if you're interested to learn more about the committee, connect with other colleagues, and so forth. Next slide, please. And then lastly, I would like to talk more about the Medical Education and Workforce Diversity Subcommittee. So majority of our efforts have really been centered around how we can address from a holistic sense diversification of the workforce. And so many of our efforts have centered around dissemination of information through publications. So listed here on the side, you see publications from prominent pediatricians as well as members of our subcommittee down below in the Journal of Perinatology that really talk about how we can promote holistic application review and other equitable strategies to promote recruitment and retention, particularly for underrepresented members in medicine. And then also how we can really build more collaborations, particularly with other organizations. So collaborations with the Institute for Perinatal Quality Improvement, as well as the American Academy of Pediatrics and a lot of the groups within that, including the section for neonatal perinatal medicine, trainees in early careers in neonatology, and their DEI and anti-racism group, the Organization for Neonatal Training Program Directors, and then most recently, we have what's called the Representation and Equity in Neonatology Interest Group, which is centered on really bringing underrepresented members within neonatology to collaborate, to build community, and to learn from one another. And so if you are interested in participating in any of these organizations and a member of the AAP, for example, please feel free to reach out to one of my colleagues who's also a junior lead for our Medical Education and Workforce Diversity Subcommittee, Dr. Michelle Pena, and I've listed her email down below. Next slide, please. And so I also want to take a moment to share a little bit about some of the behind the scenes work that we have been working on within our subcommittee and within NJC as a whole to really be thoughtful about how we can address health equity leadership, education, and career development in hopes of promoting workforce diversity. And so we recognize, as we've kind of mentioned throughout this entire presentation, that inequities in NICU care exist despite current efforts. And so if we were to focus on interdisciplinary training of a diverse workforce in health equity, we can see improved outcomes. And there's evidence to support that training and career development, unfortunately, is not well defined. And so our question really has centered on how we can, as an organization, use existing models on health equity leadership and training, as well as mentorship to promote a pathway or career development pathway for all health equity enthusiasts within neonatology. Next slide. So we are in the process of developing a pilot program and curriculum that we are calling the Neonatal Justice Collaborative Health Equity Leadership and Mentorship Program. And so this pilot program will include not only education of health equity within neonatology, but also competencies around equity-centered leadership, concurrent mentorship, as well as guidance in terms of career and research development. And so our focus is really centering around trainees who are in the clinical learning environment. So specifically, pediatric residents, neonatal fellows, neonatal nurse practitioner students who might be pursuing a master's or doctoral degree, and then nursing students within residency programs. And so our goal is to be, at this point, include both medicine and nursing, but with the aspiration to include multiple disciplines within the neonatal field. And so as it stands, our program will be a 2-year program with enrollment every year, beginning tentatively for late 2024. And so our aim is to include virtual learning, as well as simulation and case-based learning, mentorship, and scholarship and research exposure. And so we are currently in the process of confirming funding for this project, or for this pilot program, as well as seeking participants and volunteers to join our efforts as potential career and or research mentors, group facilitators for our learning discussions, as well as content experts. And so if you are interested and would like to learn more, I've included the QR code here, as well as a link to our form to sign up for more information. Next slide.
So we've had a number of events, and Dr. Anani has gone over a couple of these already, but just want to highlight some of the works in progress sessions that our research subcommittee has hosted. So we had 2 individuals present on the financial burden of NICU stays, and a research project investigating and understanding what that means for families, as well as how to measure racism in the NICU, what's currently being used, and how can we improve our measurement. And again, anyone who's a member in the NJC can attend these works in progress sessions and help give feedback to researchers on their projects. So we really want to have a diverse group of people to give feedback to researchers, which is one, I think, real benefit of being a member of the NJC, is to both give feedback to make research stronger, but also as a researcher to be able to obtain feedback from different groups as opposed to just those interested in research. We also have physician advocate and medical education speaker series. So both groups hold series where people who've had successful careers in medical education or being an advocate are able to share their stories and how they were able to successfully advocate for neonatal equity efforts and diversify their workforce. So we've had a number of speakers in that setting, but we also had a specific example is a nursing-led group at the University of California, San Francisco, in the NICU, who's hosted diversity, equity, and inclusion education every 2 weeks for the last few years. Came to us and shared their stories about developing and getting institutional commitment and buy-in for such a program, and compensating the nursing workforce to participate in the program over time, and sort of the challenges and successes that they've had in that space. And we've also had, an expert panel for trainees to see, again, pathways in health equity and see how different they can be. Since a lot of us have the passion for neonatal health equity, but then what does that look on a day-to-day basis, and which pathway do you choose? And then the pros and cons. So people were arguing for their specific pathway and why it was the best one, which was a fun panel. We talked a little bit about the op-ed workshop, and then wanted to say that we have 2 in-person meetings a year. We host one at PAS, at the Pediatric Academic Societies meeting in April every year. And then in the fall, we host a different conference every year. So the first year we were at Vermont Oxford Network, really quality improvement focused. And then last September, just 2 months ago, we were at the NAN conference, so the National Association of Neonatal Nurses conference, and which was also really exciting. So This picture is us at our first PAS conference in person, small but mighty group. And then the manuscript is just one example of us sort of coming up with ideas and writing together. So sharing our experiences as neonatal health equity researchers and the barriers that we've faced in our research work. Next slide. So that first picture was us at our first PAS session. And then this picture is really to show you how much we have grown. This was just at the pediatric meeting last April, where this was really like a dream come true for me as founding this institution and really wanting to see people connect and share and collaborate. You know, this was a big networking session where people were able to exchange phone numbers and exchange ideas and thoughts and really grow community. And so was really excited to see a really wide group of people with different experiences to be able to share what they've learned and start building connections. So this was a really exciting event for us. Next slide. At the same PAS meeting, we also hosted a workshop. So we did do a little bit of work beyond networking and having fun. We had a workshop where we invited not just Neonatal Justice Collaborative speakers, but also, or leaders, I should say, but also experts from outside of our collaborative. So we had individuals from the AAP come and talk to us and help us lead a session and discussion on the barriers that we face when we're doing neonatal health equity work, and then strategies that we can use to overcome those barriers. And so there's a lot of rich discussion, again, because we had people who had different amounts of experience in the work, kind of just coming to it versus having done neonatal equity work for, decades, and being able to share what they've learned and what strategies worked well and didn't work. And so we had both small group and large group discussions, and we're hoping to write about the ideas that came up in this workshop so that we can share with everyone kind of experiences that folks had. Next slide. So we have a number of upcoming events that Dr. Anani kind of described many of these. So tomorrow, the QI subcommittee meeting, we have our next works in progress session next week. Our general body meeting, that's a virtual meeting, is in January. And we have we will be at the Pediatric Academic Society meeting in not April, but May this year. Next slide. So we are a very humble committee with humble beginnings. We are grassroots and unfunded, and we have been from the beginning. We are really have been built with volunteer work, and so really the passion of individuals who are interested in neonatal health equity. And so although we've had so many successes and in our collaborative, we've also had challenges, and we're thinking about how to be, financially and generally sustainable over time, making sure that we have multidisciplinary leadership and mentorship. That's really important to us and has been a very deliberate objective for us this year. We know that we do this work better when we do it together. And so this year we're taking time to get feedback from our members and leaders through surveys to make sure that we're meeting the needs of the community. And so next slide. So we would love for you to join us in any capacity. You can follow us. You can visit our website. Our website is great because we have our calendar up there. That's the most up-to-date information about when events are happening. There's also separate newsletters on the website to understand what's happened in the past, and really keeps an archive of the types of events that we've had, and then recordings of events if folks aren't able to make some of them. The best way to stay in contact, besides the website, would be to join our mailing list, so the listserv. So this is a QR code that takes you to joining the listserv, and on the form you can distinguish if you're interested in specifically, QI research, medical education, or policy and advocacy, to get more specific updates about those subcommittees. But you also will get kind of big announcements from the general body as well. And feel free to attend our next event. Again, this is all free and open to the public. And we're excited to be able to have some transitions this spring for our leadership positions. And so we'll be sending out information through the listserv of how to get involved and be a leader in our subcommittee as well for the spring. So those will be coming out over the next couple of months. All right, so I think that is the last slide. Happy to take any questions that people have.
Yeah, I saw some people had put questions in the chat, but not everybody would have been listening to those. So, would have been reading that because they're listening to you. So do you mind just restating some of the questions and the answers you put out there, Uchi? Would you mind doing that?
Yeah, no, absolutely. I think the main question I had received was around the pilot program, the NJC Health Equity Leadership and Mentoring Program, if it was for nurses and physicians only. And so for volunteers who would like to serve as content experts, mentors, and or facilitators, absolutely not. Our goal is to be inclusive and include all disciplines that work within neonatal care. And so I would encourage you that if you are interested in any of those roles, to fill out the Google form link that we have in the chat, and or to reach out to me directly, and I'm happy to share more information. Since it's a pilot program and based off the current funding that we've applied for, our goal is to try to start small and then build. So we are just now focusing on disciplines within medicine and in nursing, with the aspiration and goal intent to expand into other disciplines within neonatal care.
That's so wonderful. And congratulations for all of the progress you've made. It's a lot of work to put this together, and 2 in-person meetings a year. That's just fantastic. And I can see the energy building, and it was really exciting. We got connected, the Institute for Perinatal Quality Improvement got connected just because of the Speak Up program. So because one of your key leaders, Yarden, is a Speak Up champion. And so then thinking about how we can all do more work collaboratively, Yarden is now on our executive board so that we can have really help each other along and really make a difference. So are there any, do you have some in your education, and feel free, everybody else, put in questions in the chat, but while I'm asking my question, so you've already been doing some education, if I understand that right, and some QI initiatives. Do you have some example, like early wins in some of those topics? I know you've got some papers you posted about that, but just any little, I'd love to hear just like some specific things that you feel have been really successful.
Yes, we could definitely talk a little bit about quality improvement, since I know this is the audience for it. So our quality improvement subcommittee is actually our newest subcommittee. So they, we had originally 3 subcommittees, and we had intended research and QI to be together. And then we ended up noticing how much interest there is for quality improvement specifically, and knowing that they aren't the same thing, we ended up having them have a separate subcommittee. So they're actually just a few months in instead of a year and a half in terms of their efforts. Their first goal is really to emphasize the education and equity focused quality improvement. That's where they get the most questions and interest, is how do we do this in our unit? And so they, as individuals, they got a lot of requests as being, EFQI leaders, but weren't able to fulfill every request that they get that's asking about more education on an individual level. But through the NJC, we've been able to host bigger sessions and share the group's knowledge with bigger groups. And so they just hosted that equity focused quality improvement education session at the CHNC and got a lot of great feedback. I actually got a lot of emails afterwards that people really enjoyed the session and felt like it helped with tangible, hands-on next steps for people to move forward. And so they have a lot of aspirations in the QI subcommittee, that Dr. Anani presented, like, efforts to standardize things like racial and ethnic variables when they're doing QI, and a number of other things that they want to work on next. But right now their focus is on equity focused quality improvement education and hosting these sessions throughout the year to help people understand where to start in their institution.
Yeah, I do. I think having better data sources so we can actually see the the inequities, right? So that's a really huge part of that, and honing in on problems. So let's see, any questions? No additional questions have come in. And I also think, anyway, I do think that the multidisciplinary approach is really important as well. And you're specifically asking this group, which I know a lot of nurses are in this meeting today, you're asking for more to broaden your leadership team to include. So would you describe that again, like how that goes? Like, do they just, if they sign up for the listserv, what's the best way for someone on this call to get involved, and just kind of walk us through that a little bit?
Yeah, I think signing up through the listserv is definitely the best way. That QR code and link should get you to a form that then puts you on all the communication channels. So that's how you hear about new events. That's how you get in the subcommittee meetings where they discuss their goals for the year and how they're going to direct those. And then the actual events themselves, like joining an op-ed workshop or works in progress session. So that's the best way to get involved.
Cool.
Yep.
And a question came in: what funding options or channels does the NJC use or hope to use?
That is a great question, Erna. Thanks for the question. That is something that we're talking about very actively in our group. I'll let Dr. Anani talk about the funding for the mentorship and training program specifically, but for the broader Neonatal Justice Collaborative, we started unfunded very deliberately. We wanted to have our own mission and vision that was independent from other organizations and groups to really understand who we are and what our intent is without having the influence of other organizations to help shape that. Moving into the next period of sustainability, I think funding will be really important. And so we're looking at different ways to how we can support ourselves as an organization and what that might mean, whether that's partnering with another organization or multiple organizations, or establishing our own funding, like the nonprofit type of route. And so we're, actively having discussions in that realm. And I'd love to learn from anyone on this call who has experience in this session. Again, a humble organization, humble beginnings, but small but mighty. I'll let Dr. Anani talk about the specific grant for the medical education project.
No, absolutely. Thank you. And so for that pilot program specifically, we are seeking funding through the Josiah Macy Jr. Foundation that specifically funds research and projects around healthcare education, and is very intentional actually about being interdisciplinary. So not focusing on those within medicine, but also outside of medicine. So there's a very large nursing representation as well. And so there are 3 pillars centered around work, healthcare education that is focused on the clinical learning environment, that is focused on promoting diversity, equity, and belonging, that's centered on interdisciplinary work. And then also for those who may be interested in ethics as well, centered around navigating ethical dilemmas within the clinical work environment as well. And so that's currently, there are multiple options within that foundation. So, but other options that we've looked into as well include Robert Wood Johnson Foundation, as well as I think the NIH has a few R series that center around promoting educational research around educational research around research. So we are also actively looking into those opportunities as well.
Yeah, and if I would imagine that if anyone on this call has any ideas or suggestion, like you'd probably be open to hearing that too.
Absolutely.
And yeah. So what else did you, anyone else have any other questions you have for our esteemed speakers here today? Just be sure to put them in the chat. So yeah, I'm interested in the internship program. It sounded like there was a lot of interest in that as well. And I think in particular, when people talk about equity and justice, that it making that real to people, like what does that actually look like? What are we talking about? What does that mean? And so do you have any anecdotes or any specific like ideas around like what does that look like when you're giving rounds or when you're doing handoffs? And I know, for example, in our Speak Up courses, we've had participants tell us about they did a QI project where they actually tracked how many times security was called and what was the race of the family when security was called, and found that it was more predominantly people of color where security was called. And they had, without doing that data analysis or without looking at that, they hadn't even realized that that was an issue for their neonatal unit and for themselves. So I'm just wondering if if you've seen or if you have in some of those case studies you've put together, some specific areas that you've been focusing in on.
Yeah, I can talk a little bit about how to make sure that people leave with practical, tangible takeaways and things to bring back to their unit. Yeah, I think that the case studies is a really great way to start conversation about what something might look like in real life, and then how to apply it in real life, and kind of go through, just like we do our simulations, our mock codes, kind of practicing for real life situations. So Dr. Animesh Sobnis, who has been an integral member of the NJC, and I hosted a workshop at the California Association of Neonatologists, or CAN, where we presented a case that dealt with that similar issue. So inequitable use of security calls specifically, and CPS referrals. And so we shared a case of a Black mom who experienced both of those events in our unit. And we talked about root causes, talking about interpersonal and institutional and structural racism, and how this event happened, what led into it, what are root causes, and then how could we have done things differently, and moving to the future. And so we hosted this workshop last year and got a lot of, I think, good feedback about learnings that people took away from the case. And so we're we're writing one of that case series, and then contextual information through the Neo reviews or Pediatrics Journal to share that type of workshop and learning, so that it doesn't just happen in one room in one city one time last year, that many people can use this type of workshop and run through that scenario and questions and host their own workshops across the country. And that's really what the NJC is all about, is like the hard work that someone or a group of people come up with to try to tackle an issue is not just learned by one smaller community, but instead is open, available, and free to more to everyone across the country to learn from, because it's not about sharing or not about withholding like resources. We really want to share them when possible. And so that's the type of thing that we're hoping to do. We don't have a lot of, we're not sitting on a pile of data or a pile of money that we can share, but we can share each other's experiences and resources and get to know each other and support each other's work. And so that's what the NJC is all about.
Well, and I love that case-based approach. And why should that same scenario happen everywhere? And it also models how to review from an equity perspective and actually see something and discuss it in a way that can get it resolved and stop it from happening again. Did you have anything else you wanted to add, Dr. Anani?
Yeah, sorry. I guess I was more contemplating about like, how would we, I get asked this question a lot about, particularly the medical education, what are the tangible things that we would see through these efforts, these case-based, workshops, education, et cetera. And so in my mind, one of the aspirational goals is that, like we mentioned before, we'll see actual changes within units and within hospitals. So I think of like policies that are changing and practices that are changing. So you'll see more people who assume leadership roles that are attuned to like an equity-centered focus when it comes to navigating care. You'll see more specific check-ins or I don't know the word I'm looking for, but like a checklist where you're addressing health inequities during rounds. You'll have more M&Is that are centered around addressing health equity within your quality improvement work as well. And so that's how I envision it. And we'll actually see that it's integrated within all aspects of the clinical work environment or academia or whatever environment that may be within neonatology.
I love it. There was some comments and question from Prasanthi. And I don't know if you're able to see that, a question that says, how many times coordinators and staff who really were aware and knew what, when, who, and how to of referrals and team of professionals to involve into when NICU graduates care came home, when it came to home-based care agencies or early intervention state-based systems. So I'm not quite sure. And then clarifying, I see this is where there's a lot of gaps or misjudgment. So from caregivers and parents, and it has to do with equity of services comes into question. So I've seen that too. You mentioned that, Kayla. And do you want to comment on that? We just have 2 minutes left, so before we have to close, but any last thoughts about that or other things you wanted to say before we close?
I think just agreement that there's definitely a gap in that transition to home period where a lot can slip through the cracks. And that's something that we certainly have heard in at least my research from families, that this is an area that they would love for us to focus more on, because it's such an important time for families is going home. That's the goal. And a really big moment. You want that to be a successful transition and set families and caregivers up for success when they get there. So don't really have a specific comment, just a total agreement.
A lot of work to be done. And I'm so glad that everybody's here and that you formed your collaborative to help jumpstart and help support this effort across the country. So thank you again for speaking and sharing your insights with all of us today and all of your work. And hope we all will continue to collaborate and grow this wonderful work that you're doing. So thank you again, everyone, and for being here today.
Thank you guys. Really appreciate the space.
Thank you.
Bye.
Thank you.